Heart disease is this country's #1 killer, and in Louisiana, we're at an even higher risk. And those affected with conditions now have a chance to tell their story about survival.
I was diagnosed with dilated cardiomyopathy. The left side of my heart is 3 times it should be, and I have 10% of my heart function at that point in time. If I look back now, I was exhausted, but what woman is not exhausted? I had a 2-year-old. I was finishing my PhD full-time. I worked full-time, so of course I was tired. Had I not gone, I just would have never known. So that family history was so important to know.
And you heard her story. We're joined by Mary Leah Coco, the 2013 Go Red for Women National Spokesperson, along with Dr. Nakia Newsome, a cardiologist. So welcome.
Oh, thank you for having us.
Yeah, so Mary Leah, tell us a little bit about this event coming up. People have their own chance to tell their story.
On April 24th, the Baton Rouge General Bluebonnet campus is hosting a casting call. And so it only takes 5 minutes of your time. And so what we want women to do, women that are impacted with heart disease, those survivors, to come out and share their story. People think that they have to have a big dramatic event to make an impact on others. And heart disease is really more than just about a heart attack. It can be having high cholesterol, high blood pressure. And we, as women, tend to listen to other women. So we really want to encourage all of our survivors, and maybe those that have lost a family member, because the survivors of those that have died have very impactful stories as well.
Okay, so kind of paint a picture for us. What can women expect when they show up?
One, valet parking. So that's fantastic. People worry about parking. So there's free valet parking on the campus. And it's only about 5 minutes of your time. We want to know who you are, what's your story, and how you think that you can change the lives of other women.
Okay, great. And I mean, what have you heard? What other stories are there out there? I mean, there's tons of stories. Are they big stories, little stories, anything?
Anything. One of my dear friends that I've come to know over the last couple of years was a triathlete, literally running triathlons, and felt like something was off. Her doctor said, "I'm sure it's not this rare heart condition, but let's just check." Well, of course, it's a rare heart condition, and she now has a defibrillator. And so all those little signs and symptoms as women, we can sometimes tend to ignore, and it takes great doctors like Dr. Newsome to really take that next step. And the Baton Rouge General championing this casting call is amazing. And the American Heart Association saves lives. And if you look at one woman dying every single minute, if we count those women as 1 mile, we would wrap the earth 21 times.
Wow.
Every single year.
Wow. And Dr. Newsome, we don't have a lot of time left, but kind of tell us some of the major signs that women should look out for.
Well, some of the things you should look out for is actually, she was noting extreme fatigue, shortness of breath, swelling, chest discomfort. These are important things to note, and you need to contact your doctor if you have any symptoms.
Okay, great. Well, thank you both for coming on the show today. We appreciate it. And also the information too about where you can share your story. Go to Baton Rouge General between 11 and 1 on Thursday, April the 24th. And then there is the Heart Walk in 2 weeks. This year's goal is just over $1 million that would go to outreach and education about heart conditions. Right now, the donations total almost $650,000. The walk is on Saturday, the 26th, on LSU's Old Front 9 at the corner of Nicholson Drive and Nicholson Extension. Activities begin at 8 in the morning, and the walk starts at 9. It's free to participate. You're watching WBRZ News 2 at 4. We'll be right back.